Hello, everybody, and welcome to today's webinar with RMI Oceania. My name is Emily. I'm the Senior Campaign Lead here at Birchal. And just before I introduce you to the team, I would like to acknowledge the traditional owners of the lands that we are coming to you from today. Birchal is based on the lands of the Wurundjeri people of the Kulin Nation, and we pay our respects to their elders past, present, and emerging. So today I am joined by Adam and Andrew. We're about to be joined by Matt from RMI Oceania. So Birchal's working with RMI Oceania on their upcoming crowdsourced funding offer. A few of you might be a little bit unfamiliar with what crowdsourced funding is, or you might know it as CSF or equity crowdfunding, but it's a relatively new form of fundraising in Australia. It started back in 2018, and it allows startups and small businesses to raise capital from a large number of smaller or retail investors, as well as wholesale or sophisticated investors through an online platform such as Birchal. So instead of seeking traditional funding, such as banks or venture capitalists, companies can turn to the general public, and that's often their communities, to raise money in exchange for equity in their business. So Birchal Financial Services will be the licensed intermediary for this offer. And I do want to remind everybody who is watching today that the discussion in this webinar is for informational purposes and should not be considered as financial advice or a recommendation to invest. So please do your own research, and please always consider the offer document and general CSF risk warning before investing. If you do need any more information, please head over to birchal.com. If you have any questions about what equity crowdfunding is, that's your best place to go. And if you've got any questions regarding the specific offer on hand, you can always reach out to the RMI Oceania team via their Birchal profile. There is a message button that you can reach out to them from. Okay, now today's session is going to run, essentially the founders will take us through a bit of a presentation that'll be approximately 15 to 20 minutes long, all about RMI Oceania, where they've come from, what they're looking to achieve with their capital raise, and how you can get involved. We'll then switch to a Q&A session. So if you look at the bottom of your Zoom screen, you'll see a little Q&A bubble. So if you've got any questions during today's session, please pop it in the Q&A box as we go along, and we'll answer this during the Q&A time at the end. I also want to remind everybody that we are recording today's session. So if you do have to jump off early, a recording will be sent around. And also we do encourage you to share this with anybody who might be interested in the offer as well. So that is an option too. So without further ado, I am going to hand over to the team. I've got a little presentation that we're going to be able to share as well. Don't mind me, I'll just grab that one as well. I'll hand over to Adam, Andrew, and Matt to introduce themselves while I get the screen up.
Okay, hi everyone. My name's Adam Scott. My background is I'm a cardiac scientist. Have a PhD in cardiac medicine from Imperial College in University of London, and I'm a really passionate innovator and entrepreneur now to try and create solutions for problems that previously couldn't have been solved. I'll introduce you to Matt Saliba now, and then Andrew Coates.
Hi everyone, Matt Saliba here. So I'm the CEO of RMI Oceania and also an executive director. So I sit on the board together with Adam, Andrew, and one other director. And I'm responsible for the day-to-day operations of the company. I've been involved with Adam really since inception. My background is principally sort of banking, corporate finance, and strategy. And so I've worked with a range of companies, both big and small, over the last 20 or so years to help them grow their businesses. Andrew?
Hi, I'm Andrew Coates. I'm a heart failure cardiologist. I've been working in the field of heart failure for about 35 years, but also running a very large research group. I was head of cardiology at Imperial College and Royal Brompton Hospital when a bright young Australian came out with me in London by the name of Adam. Did a PhD with me as a head cardiac technician, and I was incredibly impressed with his performance, rapid research trajectory, and really entrepreneurial. I've also done an MBA. I've founded 3 biotech spin-offs and done about nearly $1 billion US in licensing deals. And when Adam was talking to me and said he was doing this robotic echo thing, I thought it was fantastic. So I've joined the board and helping with that in terms of the external relations, but also in terms of what cardiology needs in terms of, technology assisted access for patients living in remote communities to get the best quality investigative outcomes, which is why I'm such a great supporter of RMI.
Thank you so much. So I'm just going to share my screen for you. Unfortunately, mine is not showing in a super great share mode, but hopefully you can see what I'm showing. Is everybody able to see that?
Yeah.
Yep.
Fantastic. Apologies that this isn't in the best possible sharing format. My computer's just being a bit funny today, but hopefully this works for everybody.
Okay, Emily, if you could go to the next slide, please.
Of course.
So basically, we're going to take you a bit of a journey and tell you a story. Our main focus and vision at RMI is the universal access to ultrasound and also the elimination of sonographer injuries, which we'll go into a bit more detail. Next slide. So basically, how an ultrasound works. So ultrasound is one of the most common diagnostic procedures you'll see in health facilities across the whole world. It relies on sound waves to produce images of shape and structure of organs. And the key benefits of ultrasound is you can view images in real time. It's low cost, safe, portable, and non-invasive. It's also one of the key processes that we do in cardiology. It's called an echocardiogram or a cardiac ultrasound to detect and determine the stages of cardiovascular disease. So traditionally, we do ultrasounds manually, holding a probe in our left hand or our right hand. And so the traditional process of performing an ultrasound is very dependent on the sonographer, who is the person who is undertaking the scan to perform it. So you'll see that image on the right there. There's a sonographer scanning a patient, who happens to be myself, so that it's dependent on that person being in the room with that patient. So in large metropolitan locations, you've got plenty of access to ultrasound. However, the more regional and rural you get, and it's not just in Queensland, it's not just in Australia, it is a global issue that the ability to access ultrasound is extremely limited. So we might jump to the next slide, Emily. So our key focus is on two problems. The first problem is actual access to ultrasound. So once again, in our major regional and metropolitan locations in Australia and throughout the world, there is a lot of access. So in Australia, we do roughly 12 million ultrasounds a year. However, more than 3 million Australians live in outer regional and remote areas where there is very, very limited or nil access to ultrasound. The other focus that we are looking at is around sonographer injury. So in Australia alone, there's more than 7,000 sonographers, with 85 to 90% of them experiencing pain or working in pain for more than half of their career. And we know 20% of them suffer career-ending injuries, which means we lose them after a decade, and all of that ultrasound IQ is lost to our industry. So one of the key focus of RMI was to be able to support our sonographers to scan for long periods so that we can enable further access to ultrasound as we keep progressing. Next slide. So when we look at access to ultrasound, our rural and remote and our Indigenous communities have very limited access. And that's due to a lack of sonographers in those locations because their populations in these very rural, remote towns are so low that they have general medical facilities. They don't have access to specialty facilities such as echocardiography. So it's very sonographer dependent. And what happens is patients generally travel very long distances to metro locations to have a procedure, to have an ultrasound performed, or they wait for outreach teams to go to those locations, which means there are immense waiting periods between getting the scan done and getting the result back. So this creates not only huge stress for the patient because they have to travel long distances, take time off work, sick leave, but it also increases healthcare costs with all of that patient travel that needs to come. So as a result, patients wait very long periods of time to access these specialty investigations. So they have a 25% higher morbidity mortality compared to metropolitan locations due to that reduced access to that primary healthcare, and in general have a 7-year lower lifespan compared to metropolitan areas. Now, we know our First Nations communities are also very significantly impacted. Our First Nations populations have cardiovascular disease earlier in life, they're hospitalised more often, and they have a 3 times higher cardiovascular mortality rate. And that's due to having more risk factors and major rheumatic heart disease issues. However, this First Nations issue is not unique to Australia. This is a global First Nations problem that we see everywhere. Next slide. So when we look at our First Nations community rates and our across the globe, rates of acute rheumatic heart fever and rheumatic heart disease in Queensland alone are some of the highest in the world. We see children in that 5 to 15 age bracket being the highest risk, and repeated infections can lead to rheumatic heart disease, which affects those valves within the patient's heart. It was generally eradicated in the majority of Australians for greater than 60 years of age. However, now our rates in Queensland alone are higher than sub-Saharan Africa. This was highlighted in 2022 on the ABC Four Corners program, which was a catalyst for a coronial investigation. Cardiac ultrasound is the most effective form of detection for rheumatic heart disease. Andrew, did you want to make any comment in this space?
Yeah, look, it's terrifying. I've done work in Cambodia, rural Laos, and looking for rheumatic heart disease, which is a scourge there, and it's higher in our Indigenous communities just because of isolation and the fact that we can't get a simple device like an echo machine out to these patients. So the solution of doing it the way RMI doing it really is critical for us addressing that public health scandal, really.
Thanks, Emily. Next slide. So now the other aspect is these sonographers are so crucial to being able to conduct ultrasound, but due to the complex nature of conducting an ultrasound, whether they scan left-handed or right-handed, you can see the sonographer in both these images. They have wrist, elbow, shoulder, back, neck, hip injuries due to the sustained, long-held positions that they have to hold to be able to acquire these images. So they are at a much higher risk of long-term disability. With generally, we see there's in some instances, career changes as early as 2 to 5 years. With at 10 years, they have 85 to 90% are working in pain. So we see a global shortage of sonographers worldwide. We also see significant disruption to services in the health industry due to the increased sick leave, work cover costs, and also the financial challenges that sonographers face when they can't scan. So what we're seeing now is a lot of our youth coming through the health industry are actively choosing not to be trained in sonography due to the high injury risk and career limitations. At the same time, we're also getting a lot of contact from students who are going through sonography courses, recognizing that high injury risk and very interested in the solution that we're going to be talking to you today about. Next slide. So the key component around sonography is it requires a sonographer's arm to hold a probe to conduct a scan. So RMI sat back and said, what if we can still use all the image acquisition skills and analytical skills of the sonographer, yet completely remove that injury risk or that outreach travel component? So how do we do this? We don't change the process of ultrasound or the ultrasound machine. We just change the process of obtaining the images. So this means by removing the muscles and having to hold static, uncomfortable positions, we've replaced the sonographer's arm with a robotic arm, which we've got a state-of-the-art robotic system in place with software. It's lightweight, it's portable, and Matt's going to talk about our patents further down in the conversation. Next slide. And Emily, if you can press play here. So this here is a setup of an in-room robotic ultrasound system. So as you can see, on the right is a sonographer, which is remote control operating the here we go. Remote controlling the robotic arm, which you can see has a probe at the end of it, which is on the patient's chest. So the sonographer can sit in an ergonomic position and remote control the robotic arm to acquire all of the 4 acoustic windows for a cardiac ultrasound to be able to conduct a complete cardiac ultrasound, which is validated to the equivalent of a manual scan. So we might go to the next slide. So that's the in-room model, which we talk about, where we are anticipating in the next 5 to 7 years, every ultrasound system throughout the world will have a robotic arm attached to it to completely remove that injury risk, so that way these sonographers can continue to scan without having that injury burden. The second aspect of that robotic system is where the robotic arm and the ultrasound system are in room with the patient, with the sonographer. What we've done is we've created the capability to teleoperate that robotic ultrasound system. So what that means is the robotic arm ultrasound system can be located with the patient in a rural location, and the sonographer located in a central hub, remote control operating that whole robotic ultrasound system. Now, what this means, we might go to the next slide. So what this means is if we just look in Oceania alone, there is a whole raft of countries and islands and Pacific nations which currently are completely unable to offer ultrasound services. So they have a high rheumatic heart disease rate, they have a higher morbidity mortality, they have much lower lifespans due to that inability to earlier access their cardiovascular disease and treat it. And so now what RMI is going to be able to do is initiate the setup of global tele-ultrasound hubs. So we could have one in Brisbane alone, as you can see there. And that's just an example of not just servicing locations in Australia which don't have access to ultrasound, but all of these Oceania countries which currently don't. So when we talk about a sales model, which Matt will go into in future, not only have we got an existing market where robotic arms can be placed onto these ultrasound machines, there is an immense new world market where they don't currently have these systems in place, where we'll be able to perform scans on a same day, same access process. Next slide. So we've tested our model. It works. Our early evidence is really exciting. You may have seen on our website and on the Birchal site that we had an ABC story done back in January this year, which outlined the impact that it can have to a patient living 1,000 kilometers away in a remote location. So you can go online to our website and see this video at any stage, or it's on the Birchal site. Next slide. So how do we know conducting cardiology investigations can be done via telehealth? I have a proven track record. So for the last 8 years, we've been remote control operating cardiology investigations equipment in 30 facilities across rural and remote Queensland. So this enables us to provide more than 1,800 occasions of service a year, with a 2-fold increase in access and uptake in First Nations community. We've been able to reduce waiting times in these remote rural locations from 37 days to same-day access, reporting times from 36 days to 7 minutes or same day for a Holter. We've reduced patient travel from 140 kilometres on average per patient, with a per year travel saving of 140,000 kilometres per year from this program alone. And that has seen significant reductions in health costs per patient. But what we're really proud of as part of this program was 91% of patients don't travel past their local health facility to have to access tests performed at another health facility. We published this work in the New England Journal of Medicine early in 2020, which demonstrates we can do this. And so RMI has taken this concept to the next level to be able to conduct remote control operation of ultrasound in rural and remote locations. Next slide. And I'll hand over to Matt here.
Sure, thanks, Adam. So I guess the question is, how does this translate into a business model for RMI going forward? And in simple terms, our aim is to be a global medical device supplier of our system. As Adam said, the issues that he's outlined aren't unique to Australia. there are issues globally in terms of particularly that access and those injury issues. So the aim is we're looking to sell into what is a large, well-established market, and it would be a business-to-business type sales channel. So in terms of how we see our customers using our system, there's really two key modes of deployment, which are aligned to the two issues and solutions Adam has just gone through. So mechanism number one is dealing with that remote access issue. So this would be where customers procure our system and deploy it to remote locations, so to remote hospitals and health clinics. And they're then enabled to essentially provide a telehealth ultrasound service to communities which currently don't have access to that service. So in that sense, those communities now have a service which is equivalent to what we have in metro areas. And then the second mode of deployment is that in-room scenario. So that's where we're supplying our device to mostly metro areas where there's an existing pool of ultrasound machines. And essentially, our system is working side by side with that existing ultrasound machine so that a sonographer can conduct an in-room scan, as they do now, but without any risk of injury because our robotic arm is doing all the hard work. So they're the two key means of deployment. RMI would supply the equipment, and our customers would essentially provide everything else. So they provide the sonographers to do the scans. In the remote setup, they provide obviously a location for the device, a nurse to assist with patient management, and everything that goes around providing an ultrasound service. So, patient booking systems, image acquisition, recording systems, all of that's provided by the customer. In terms of how we see this playing out in a commercial sense, we've already been able to establish initial contracts with Queensland Health. So we have 3 multi-year contracts with Queensland Health where they've agreed to procure 3 of our systems. So we've manufactured and deployed 3 systems already. One of the systems is located in Brisbane, and then we've got one in Longreach and one in Cloncurry, which are 2 remote locations in Queensland. So even though we're at a sort of pre-commercial stage of operations, it's been fantastic that we've been able to have this great relationship with Queensland Health, and they really recognise the value of our technology and and the difference it can make in terms of particularly servicing those remote communities. So in terms of our initial rollout, we really see that those contracts form a template for that commercial rollout, not only with Queensland Health, but with other public and potentially private groups going forward. So on that slide, you can see the commercialization stages. We're obviously focused on Queensland. We're based in Brisbane at the moment. And the idea would be to essentially piggyback off all of that great work that Adam's done in terms of that cardiac telehealth program. So that's already operating across 30 sites. So that gives us, again, an initial footprint of places to target. But then we see ourselves quickly sort of rolling out across other Australian states and territories, particularly those that have similar geographical issues to Queensland. So obviously Western Australia, Northern Territory, New South Wales, all of those areas have already expressed interest in using our system. But as I said, we're looking at making this a global business. So looking regionally, Pacific Islands, Southeast Asia, but then also internationally into major markets like US and Europe. And obviously we'd look to potentially partner with major players. There's some very large major incumbents that operate in this space. And so we see benefit in working with them and sort of utilizing their existing infrastructure and distribution networks to access those global markets. I'd just touch on just quickly, which we've got on this slide. We also see a real benefit or opportunity in terms of training and education. As part of developing our system, we've had to develop a training program to go with it. And so we've got a proprietary training program, which is a virtual training program. And so we see an opportunity to provide that training either as part of supplying our system or potentially as an additional revenue stream. So it may be that we partner with a tertiary institution to provide that training, or with one of the leading sonographer industry organizations, but we see that could have potential in the future as well. Could you just go to the next slide, please, Emily? In terms of the market opportunity, Adam's touched on this, but we see it being enormous. Just before I get to that, it's important to note, in terms of the ultrasound market, not all ultrasounds are the same, and so it is segmented by the modality. We're obviously focusing on cardiac and also abdominal at the moment, and with those two modalities, we're capturing more than 50% of the market. So we feel like that's a great start in terms of rolling out a service. And then when you look at the market size, it's quite significant. So in Australia alone, there are about 3,000 ultrasound machines currently deployed, and the market's growing at about 6%, with about $300 million per year of revenue. So if we talk about trying to provide one of our systems with every ultrasound machine that's out there, that's a potential market of 3,000 and growing. And then we obviously talked about the remote opportunity. So if we look at the 3 million Australians that currently live in rural and remote areas with limited access to ultrasound, if you translate that into a demand for just cardiac and abdominal ultrasound, it translates into about 600,000 potential ultrasound procedures per annum. And it's important to note, this is a new market. So this market doesn't currently exist. So that's an entirely new market, which we can potentially capture by deploying our system into remote locations. And then if you look globally, the numbers get massive. So the US ultrasound market is $3 billion. So that's 10 times Australia. And then if you look at the global market, it's 3 times the US again, and growing rapidly. So it's currently $10 billion in terms of the global market, and it's expected to almost double in the next 8 years. What's really interesting is that 50% of the developing world has limited or no access to ultrasound. So the developing world is about 6.5 billion people. So that's 3 billion people which are dealing with the same issue that 3 million people in Australia are dealing with. So that's effectively a factor of 1,000 over and above just the problem we have here in Australia. And then if you look at specific countries, India is a great example, largest population in the world. They've got a massive issue in terms of providing access to medical services like ultrasound. And we've already had some really positive feedback from groups in India who see real potential with our system. And then just touching on the sonographer injury issue, Adam's obviously talked about a lot of statistics around sonographer injury, but it's important to put it in the context of sort of an economic value. And the estimates are that for each sonographer that's injured, it translates into about $500,000 of cost per year. So that's the cost of having a sonographer out of work, on sick or injury leave, backfilling with another sonographer. Typically that's a less experienced sonographer. And so there's a bit of a downward spiral just in terms of both injury, but as well as economic cost. And so there's a huge benefit in terms of providing that in-room service to sonographers. Next slide. Just looking at our sort of current status and commercialization pathway. So there's a few sort of aspects to this. We've been going for about 4 years. We've had a system based at the largest hospital in Queensland since the start of 2022. And that's been fantastic because we've had a system there in the hospital with sonographers using it constantly, providing us really useful feedback around its safety, efficacy, usability. And so we've had this really positive feedback loop of being able to take that feedback and incorporate it into our system and improve our system over the last 2.5 years. So we've had great support from Queensland Health, huge amount of in-kind support in terms of having a base of operations, having sonographers and other staff that are supporting the project. And that's enabled us to do a number of tests and trials on our system to demonstrate its efficacy. What's been really, really fantastic is that we're actually able to secure contracts for 3 of our systems with Queensland Health last year. So that's been our first revenue as a company, and that's for those 3 systems I mentioned earlier. So I think that really just reflects the real need and desire and customer pull for our technology that Queensland Health sees, and the potential they see in getting these systems out into their health network. And so we continue to work with Queensland Health. We're looking to do one additional trial to essentially round out our data set that we need. And we're also looking to augment that with an additional abdominal ultrasound study just to increase the capability of the device. Obviously, we're a medical device. We're regulated. We need to get regulatory approval. So the key sort of milestone for us to be able to move to a commercial phase of operations is to get that regulatory approval. So here in Australia, the regulator is the TGA. And so we're looking at a regulatory strategy which sees us working towards both a submission in Europe and then a submission with the TGA as well. And so we're well advanced in that preparation. And so in terms of the fundraising we're looking to do with Birchal, a priority is to use those funds for this final clinical trial, and then also to use additional funds to complete our regulatory submission. And you can see there we've been working with some fantastic partners. Canon's been a great support in terms of the ultrasound side of the hardware, Queensland Health, but then a number of other really expert contractors, BioIntellect supporting us in terms of the clinical trials. Robotics is our key contractor who's been with us really from day one since we first started developing the system. And then we're working with Ingenious in terms of the regulatory preparation. So just to make it clear, our key objective here is to get regulatory approval as soon as possible and move into a commercial phase of operations. Just the next slide, Emily. Adam, did you want to touch on this one in terms of future opportunities of R&D?
Yeah, so basically we're focusing, one of the hardest ultrasound organs to do is the heart, because it's a moving organ within the chest. And so our focus was, if we get that right, then we can move to other more stable areas, such as the abdomen, musculoskeletal, those sort of components. So we know that cardiac ultrasound using the robotic system works. We know from our early evidence with the abdominal work we're doing, it works even better. It's because of that stability and the lack of need to go through into very different acoustic windows. Where the part that really excites me is, this is fantastic where we're at the moment, but the actual enhancements we can do to this system, where we input machine learning and AI into it, will increase the ability to do scans faster and smarter, so that we can, rather than it taking 45 minutes to an hour for a sonographer to do a scan, the machine learning and AI capability, which watches and learns how a sonographer scans, can be replicated to get the exact same image acquisition, but it can do it in 1/10 of the time frame. So instead of it taking 45 minutes to an hour, we may be doing scans in future that take 15 minutes. The other aspect is that the integration with multiple different ultrasound, multinational companies is immense. And so we're already working with 3 different ones, which we're really excited about, to be able to make them compatible with any ultrasound system that's currently operation throughout the world. And then as we evolve, it will be to get the system smaller, more mobile and more durable, with the intention of potentially one day having drones that can travel 600 kilometers in a commercial airspace in a rural location, taking this robotic system to a very, very, very rural, remote primary healthcare capability and conducting scans using, satellite or Starlink or any of those components. So the future's the really exciting part. Where we're at the moment, it's amazing, but I tend to keep moving, keep looking forward, and this is what excites me moving forward.
I'll just add to Adam's comments. I think another great opportunity for us is to improve the flexibility for sonographers to not have to work at a dedicated hospital or clinic. So we see a lot of opportunity where a sonographer could potentially work themselves remotely, i.e. work from home. And there's no reason why that couldn't be implemented in the near future. And that's quite important because over 75% of sonographers are female, and there's a lot of, as well as the injury issue, there's a big challenge getting them back into the workforce. So if we can provide a solution where they're actually able to just scan remotely themselves from home, then that would be amazing for them, just in terms of giving them a lot more flexibility in terms of getting back into part-time or potentially full-time work. Just the next slide. Thanks, Emily. So just to round out, before we get to questions, I just wanted to cover on a couple of other key aspects. Obviously, for us, R&D has been a core part of what we've been doing since the outset, and protecting that intellectual property is critical, and that's been a focus from day one. So all of the work, all of the IP that's been generated since we began is owned by RMI. So that's critical. And we've also looked at how we can protect that in the form of a patent. And so we've actually filed a series of patents both in Australia and internationally. So we now have a patent granted in Australia for our system, and we have patents pending in a number of other countries, including the US, Europe, and Canada. And so the logic behind those jurisdictions was that's really where we see the logical market and the global opportunity for our system once we become commercial. So we've got that patent in place, and I guess as we continue to develop the technology, we'll look to augment or add additional patents to that portfolio. I think it's critical, again, just to reiterate that we do have demonstrated revenue from a major customer and massive industry interest already. And I think for a pre-commercial medical device company to already have revenue is really unusual, and it just again speaks to that traction that we have and that real industry pool that they see a huge benefit from this technology moving forward, and in terms of providing a solution to those issues. So we've got that in place, and as Adam said, we also have interest from a range of parties. That's from large global imaging companies that we could use to partner as we roll out. It's from public and private companies who operate in the diagnostic space, and it's from players offshore in countries that are dealing with the same issues that we're dealing with in Australia. So there's been really great interest and support for RMI and for our solution. And just the last point I wanted to make is just on our team, we've got a fantastic team, not only within RMI, but all of the other groups that support us. And I think it's if I reflect on where we've come from, in the last 4 years, we've gone from really just having an idea now to having a pre-commercial device with revenue, with a clear pathway through the regulatory process to commercialization. And that's massive. Anecdotally, if you talk to companies that operate in the industry, it typically takes 10, if not 15 years to get to where we're at, and we've done it in 4 years. So again, I think that reflects really well on just the team and the approach we've taken, just to really focus on a goal and achieve it in a short period of time. So if we go to the next slide, Emily. So look, this is really just highlighting, I suppose, our key selling points, I think, which we've touched on. So I might just leave that up on the screen and see if there are any questions.
So we've got, I can see there's a couple of questions up there already, which was around expanding to multiple medical disciplines. Yes, we are looking at not just cardiac, abdominal, musculoskeletal, pediatric, which covered that. And yes, again, looking at that capability to decrease in size. This is prototype A, and we're looking at how we get to prototype, J. So the other question was around, do you have IT data storage responsibilities, or does that sit with the healthcare providers? So to answer that question in two aspects is, if you buy the robotic system that's used for in-room, then you use the existing facilities reporting software, IT storage systems. However, if a facility is looking at RMI delivering the service as a clinical hub, which is what we're planning to do, to set up a hub in Brisbane and be scanning patients at Longreach and Fiji in Asia, then we would set up all of those IT data storage capabilities and reporting systems within RMI to be able to perform the scan, bring the images back, report them, and send the report back to those locations. So all what those rural or remote facilities would need is the actual robotic ultrasound system, and that's it. But Emily, happy to hand over to you.
Sorry, my mouse disappeared and I couldn't actually control anything. So that was fun. Zoom is doing wonders for all of us today. Perfect. Do we have another slide to go through, or are we finished with the slides?
No, that was it. We're just on to questions, if there are any.
Okay, great. I'm going to try and stop sharing my screen. Okay, can we see everybody? Perfect. All right. So are there any current or anticipated competitors in this space?
Yes, so this robotic technology is evolving rapidly at the moment. The key focus in the past has been around abdominal, and a lot of the systems that were developed were very clunky, large, non-transportable, and extremely expensive. So their uptake was very, very low. But they're constantly evolving. So we watched, listened, and learned what others had previously done and developed our system for its lightweight, mobility, ease of access, ease of using, so that we can do the scan as similar as possible to what a sonographer would do while maintaining that evolution in technology and development. Matt, you may.
Yeah, I just add to that. So I think, there are very few examples of companies that have been able to do this successfully. I think, key one is just historically the technology that they've used has been quite antiquated. So there's been a massive improvement in robotic arm technology. So, one system which I'm aware of, is using a much more antiquated arm, and it requires essentially to have a person at the other end kind of moving the arm to do the scan. We don't need to do any of that. Our arm is completely controlled by the sonographer at the remote location. So in that sense, that's a big leap forward.
And the other aspect is sonographers like to use certain ultrasound machines from certain companies. So instead of us developing a new ultrasound system that doesn't have the image clarity, we've partnered with different ultrasound companies to use those existing machines that sonographers already like using, so that uptake is already there. Whereas there's another group located north of Australia who have created their own ultrasound system and robotic arm, but the uptake of that ultrasound system is unknown because it's not a tried and trusted and known. Most all sonographers and cardiologists like certain types of ultrasound systems based on what images they can acquire and the quality of those images. So we've been very smart in who we've partnered with to remove those barriers, which we know would have limited uptake.
And just finally, I think a key differentiator for us is, to our knowledge, we're the only known system that can actually do a comprehensive cardiac ultrasound. So as Adam said, all the other systems have really just focused on abdominal ultrasound, which is relatively straightforward. Cardiac is the hardest, and we've been able to crack that nut. And so that's been huge.
Great. Is there the potential for making the technology smaller to allow for point of care capability?
Yeah, the capability is potentially yes. So that point of care capability means that you've got, if you can minimize the size of the robotic arm, but also transport it to where it needs to go, yes, that potential is there. We know what we've done, the system we've set up currently will go through various phases of evolution based on the need to transport it on an RFDS flight. So how heavy is it got to be? How light's it got to be? And so we will evolve the system based on the need as it progresses. So in the first instance, we're focusing on that in-room and telehealth capability. But as interest further evolves, that point of care is required, then we will focus our attention on that to downsize it, miniaturize it so that we can support that capability.
Great, thank you. Do you have IT or data storage responsibilities, or does that sit with healthcare providers?
Yeah, so I answered that one earlier.
Great. Can you elaborate on the sales strategy in targeting new remote or rural locations? It currently sounds like the system would need to be sold to GP offices or clinics. Is that correct?
So the capability we're also trying to be smart. So rather than a very small practice buy a very, an ultrasound machine and a robotic arm and all of that reporting capabilities when they've got a very small population, what we've gone down the pathway of is more looking at providing the service via telehealth into, say, a GP practice where the equipment is leased based on the amount of scans they think they need. So if they think they need 3 scans done a week, then a lease agreement, service agreement can be set up to scan 3 days a week so that they've not got equipment that they're paying for that is sitting around not being utilised. So from that perspective, we're trying to think of removing those barriers where areas that do need it, we can create that capability with that immense cost burden to them.
Perfect, thank you. So can you do ultrasound guided procedures with the robotic system, for example, cortisone injections?
So we haven't looked at that yet, but that is definitely in the pipeline. There's a whole, as we said, we're focused on cardiac at the moment, have done some early abdominal work. There's a whole raft of flow-on other procedures that I'm really excited about. And that question that you've just asked, yes, that's something that's in the pipeline, but other aspects such as stress echoes, where we do an echocardiogram stressing the body, which is a key integral investigation, which really excites me to be really challenging, but there's lots of different other adjunct areas that we can add to that we will keep evolving and developing based on the willingness and the need that is out there.
Awesome. Will the systems be manufactured in Australia by RMI, or are you using contract manufacturing services?
Yeah, so this is something we've sort of been grappling with, and at the outset, or at least in the medium term, we would anticipate to use local contract manufacturers, and so one of the companies we're working with, Ingenious, is a medical device manufacturer based in Melbourne. And so they have experience manufacturing somewhat similar devices, some that have been used in kind of a remote context. And so the idea would be they could actually manufacture the device on behalf of RMI. It would be branded as an RMI device, but essentially we could use their capability to manufacture the system and not have to essentially build all that capability ourselves. So, whether in the future we become a manufacturer ourselves, I'm not sure, but in the medium term, we've got a clear path in terms of supplying systems once we're commercially able to.
Thank you. Have you considered what ongoing servicing or maintenance is required for the remote equipment, as a lot of these remote or regional areas might be difficult and slow to access?
Yeah, that's a great question. And that's something we focused our in our very early development stages of developing a system that can be updated, upgraded, via networks. So any of the coding, any of the updates can all be done remotely into that system, but also the capability that these systems are robust so that they have a yearly service, so that our team go out and service that equipment. And we've already been testing that and doing that with our Longreach and Cloncurry systems that are in place. So yeah, we recognise Australia is incredibly decentralised and very widespread, and accessing certain areas can be incredibly challenging. And that's at the forefront of our mind in developing these systems to make sure that it's easy to use, easy to access, and easy to service.
Do you have any concerns around defensibility of your IP?
Well, look, I guess in short, no. I mean, we've gone through a fairly rigorous process in terms of being able to, get this patent granted in Australia. So, in order to get a patent granted, there has to be a review of all prior art. And so, a review was done both in Australia and globally, and based on the structure of our patent and our claims, it was clear we weren't infringing on any existing patents, and that we've actually created novel claims in terms of what we've included in the patent. And while we've only had a patent granted in Australia, based on the reviews done in those other geographies, there haven't been any red flags that have come up. So we don't have any issue, or we don't foresee any issue getting those additional granted patents. And I think we just have to keep evolving the technology. So I think, as Adam alluded to, there's a huge number of potential, I guess, developments we can do with respect to AI and automation and other things, some of which are already built into the system. But I think, like any medical device or technology, developer or manufacturer, in order to stay relevant, you have to keep developing and improving. So, as I said, I think, it's been great. We've been able to get the initial system patented, but the aim would be to keep incrementally adding to that IP and getting additional patents as we move forward and as the technology develops.
Awesome, thank you. And what inspired you to go through equity crowdfunding versus traditional funding?
Do you want me to take that, Adam, or did you want to take
you take that, Matt. Yeah. That's your space.
No, look, I guess a few things. We've been super lucky. We've got a small and super supportive shareholder base. So we've done 3 rounds of funding to get up to this point, and that's been with largely the original set of shareholders, and we had a few additional shareholders come in the last funding round. But I think, from our perspective, it's been somewhat insular. We've been really head down, bum up, running as fast as we can to try and, achieve the outcomes that we want to achieve. And I think, which has been great, but one of the downsides is not many people know about us. Not many people are aware of what we're doing. And so we thought, through the Birchal platform, it would give us, I guess, a platform to actually do a bit of marketing of ourselves and make more of the general public aware of what we're doing, which is, it's more challenging when you're just kind of dealing with individual investors. And I think it's been, the proof is in the pudding. It's been fantastic to see the just all the feedback we've had from investors and just people that have been made aware of what we're doing through this crowdfunding round, and they've just echoed what we knew was already there, which is there's massive issues with access for rural populations in terms of accessing healthcare. Responses from so many sonographers talking about the injuries they face and how this could be essentially life-changing for them. So I think for us, it was not only accessing a new pool of capital outside of where we've sort of the investors we've used before, but also just giving us more of a public platform and getting more awareness about both the issues we're dealing with, but also the solutions we're looking to provide.
Brilliant. Thank you so much. We're just about out of time, but I wanted to say thank you so much for your time and for such an in-depth and terrific presentation. It was so great. And thank you everybody for your amazing questions. If we do hop off and if anyone has any additional questions, please feel free to reach out to the team via their Birchal profile. And also if you haven't expressed interest already, please do so. I'm just going to pop the URL in the chat box for everybody so that they can reach out if you need anything at all. If you do have anything related to crowdsource funding in terms of your questions, please reach out to support@birchal.com and we'd be happy to help out. And I want to say thank you to everybody for your ongoing support with the RMI Oceania team's equity crowdfunding raise so far. It's been great to see all the engagement we've had so far. So thank you very much.
Thank you.
Thanks, everyone.
Really appreciate it.
Thanks, Emily.